So with Polygia, we've been working on neglected tropical diseases, which are 17 diseases identified by the World Health Organization as neglected, largely financially and in terms of attention on the world stage, particularly in reference to what are called the big three tropical diseases: malaria, HIV/AIDS and tuberculosis. NTDs affect over 1 billion people, and their range of impact is spreading, particularly with climate change and the increased social mobility worldwide. Treatment of NTDs is one of the most cost-effective health interventions that there is, and it is recommended by both Giving What We Can and Give Well. Our policy focuses on neglected tropical diseases, particularly in reference to community empowerment, vector control, pharmaceuticals, mass drug administration, and e-medicine.
So I suppose an important question to be answered is, why should you care about neglected tropical diseases? Why have we chosen this to focus on as our theme for the conference? Well, it's a big problem. NTDs affect over 1 billion people in the world, so that's a good start. And as a neglected problem, that represents a deal of risk. Spread of problems throughout the globalized world that we live in can happen very rapidly. Just take the recent Ebola crisis, for example. Ebola was not a huge issue on the world stage, I think it'd be fair to say, until suddenly it was. And neglected tropical diseases as neglected problems, we're running the risk of a similar thing happening again. Dengue fever is an example of a neglected tropical disease, which has every opportunity to spread now, largely due to climate change. So it's increasingly affecting urban populations, it's affecting developed countries as well. It's quite a problem in Australia, and becoming more so. So the reason that NTDs are so important as a topic is that they affect so many people in the world, but they can equally, if they're neglected, one day erupt as a potential problem on a much larger scale, closer to home. So one of the key aspects of all of the policy that we've written and researched as part of our work up to this conference that we're having is the idea of community empowerment. Now, that's a phrase that has possibly been overused in the past and has been argued to be rather loosely defined. But actually, with the work that we've done, we've taken the approach that empowering a community really means focusing on providing the resources for people in low-income countries and middle-income countries to be able to access the services that they need, to be able to fight for improvement in those services, and really to be able to learn where to go to get the resources that they need to improve their lives on a daily basis. And that's really the underlying philosophy of all of the papers that we've produced for the conference. One of the things that's really key is to engage people and really help people to get involved and actively participate in the solutions to the problem of NTDs.